Very interesting case of a woman age 55. দেখো 55, yeah. কোথায় কোথায় আছে ঘুরে দেখান একটু। You see the neurofibroma? উঠে দেখাও, এখানটা দাঁড়াও, ঘুরে যাও। It's extensive and it has spread all. It's neurofibroma, isn't it?
So it's a congenital disease called neurofibromatosis or von Recklinghausen's disease. It's congenital, so you can see the patient has a tendency to form multiple fibromas. These are made of conjunctive tissue, yes, and they are benign tumors, but the thing is that she has them everywhere. The biggest is on the back of the head, but she has everywhere. So if you want to have a look, it's a differential diagnosis also with lepra or the Hansen's disease, but this is congenital. So if we ask her, since the most probably is
জন্ম থেকে আছে এটা? জন্ম থেকে আছে? না। কবে থেকে? এটা হচ্ছে বাচ্চাবেলা আমি পড়ে গিয়েছিলাম সানা থেকে। She's not sure, to be very honest.
I know.
She's saying she had an injury in childhood. তারপরে? তারপরে ধীরে ধীরে কেমন বড় হয়ে গেল। কোনটা? It started with the large one. She's saying in childhood.
Okay, yes.
She's not sure, to be very honest.
Okay, yes, but I mean,
her son has it as well. So son is standing
yes,
outside.
It's congenital. Yes,
Quite
congenital.
Yeah.
So that's the thing with it, and it's those are benign tumors, conjunctive tissue tumors. Someone can be taken away with surgery if they are interfering with life's patient, but it's a congenital disease.
Operation হয়েছিল কখনো?
হঠাৎ 8 বছরে যাই বড় হয়েছে, কিছু করা যায়নি। আমার বাবা তখন অপারেশন করতে দেয়নি, বলে অপারেশন করতে দিলে মারা যাবে বলে অপারেশন করেনি।
She didn't want to go for surgery. She had been advised by conventional medicine for surgery for the large one, but she didn't want to go for it.
8 বছরে এখন কেন করে ভারী লাগছে।
ঠিক আছে।
জ্বর হচ্ছে, বা কেন এত বড় হয়ে গেছে এটা।
কবে?
8 বছরেই ফাল্গুন মাস।
She had this started to flare up in childhood. ঠিক আছে, ঠিক আছে, পরে শুনছি।
Yes, and the tumors, they appear in the tip of the nervous terminations. Yes, so that's why that's a mixture of conjunctive tissue with the tip of the neurons of the nerves. So that's why
পেছনে গিয়ে একটু দেখিয়ে
that's why
আসুন
it's
তো।
called
এদিকে এগিয়ে যান, এগিয়ে গিয়ে
neurofibromatosis.
দেখিয়ে আসুন। Yeah. Sons hasn't been so much, so it's better. Sons is getting better, but she came to us for her son mostly. But she said that, I don't want others ones to be enlarged like this one. So that's why her major concern is she doesn't want any other fibroma to be as this size as other ones. So I told her maybe we can't reduce, but I will check for the progress so that it doesn't flare up like the one in the neck. Right. So for her the case is fibromas. You understand, painless. It's generally no pain with these. She has occasional contraction right leg. Miasm? You understand, it's crying out loud psychosis. So much growths, excess. You have to prescribe a psychotic remedy. She has sun headaches and vertigo. Again from the sun, the vertigo. She gets frequent cold resulting in sneezing, and she has stress incontinence as well. You understand stress incontinence, sneezing causing involuntary urination. I mentioned about the contracted feeling in the right leg. She's irritable. She likes salty, spicy. She has occasional night terrors. She wakes from the sleep shouting. You understand, we always share with the management that what I can do, maybe the ones which are there will not go away, but at least I can prevent further progress. That's what I can promise to her, you know. So that was the thing which I mentioned. We started in April 2019 with Natramur. Considering psychosis, the fibromas, desire for salt, stiffness and contraction. I want you to open Allen's, please, for Natramur. You'll see there's a line, hamstrings are stiff and contracted. So there's a tendency to stiffening and contraction of the muscles in Natramur. Stiffness of the hamstring muscles, contraction of the hamstring muscles. You got that? You have that in causticum, Natramur as well. You know, like at night they have extreme stiffness of the muscles, they wake up, you know, shouting. That kind of muscle cramps and stiffness. No, because I thought it was psychotic, that's why with the totality it helps, you know, it matches in just in that way. But nowhere in no Mitramedicas it mentions about fibromas. No. You got the points for Natmur. I repeat again, desire for salt and salty, stiff and contracted, irritable, sun aggravation. She mentioned about the something with sun vertigo, and the neurofibromas are psychotic. কোনো পরিবর্তন আগের থেকে? Any change? বলো। এই ছেলে কই? কোনো পরিবর্তন হয়েছে আগের থেকে? কিটা? She feels that this one has reduced a little bit. I asked the son as well. তার থেকে একটু কমেছে। Any আর অন্যগুলো কোনোটা কমেছে? নতুন কোনো হয়েছে? I'm asking if any new has come up, but you understand it's difficult for her to tell as well because it's all over the body, right? আর এরকম ফুলে যায়নি তো কোনো? Every time what I generally ask as a sign for follow up, you know, A, has there been any new growth which has increased to this extent, right? No. And B, if she feels like a heavy feeling here, right? So in terms of sensation, she can tell me that the heaviness is better or worse. You understand? Because of the weight of this swelling, she feels like a heavy feeling here. She says that the heaviness has reduced to a little extent. You can't, obviously she hasn't measured it, but she says that the heaviness is a little bit better. So those are the points for us to judge, should I repeat or should I wait? You understand there is no emotionals, there is no definitive generals for us to understand if it's getting better or not. Signs of improvement is generally judged by any new lesion which has increased to this extent or the heavy feeling which he says of this, right? We started with 200C. I haven't repeated that much. 200C again was repeated in June and 1M in October. That's it. You understand she's content with the treatment and nothing new is flaring up to this extent, right? So we are happy because she's happy. We're boosting. বাবা মার ছিল?
না, আগে এরকম মাথা উপরে ছিল, যখন বড় হইনি।
বাবা মার বংশে কারুর আছে? দিদি, ভাই, বোন?
আমার বাবা আর আমার যেটা দুই ভাই, এটা দুশো লোক হয়ে গেছে, কারণ নয়, খালি আমার।
No, not in the last generation. আর ছেলে মেয়ের কার আছে? তোমার? আর কারণ নেই? বোনেরও আছে? Both her children have it. Right? Not in the previous generation, but both her children have it. This is also interesting, you know, because she's presenting to you features of psychosis, right? Her parents may have another feature of psychosis, right? So whenever it goes to the next generation, it may come in the same form of psychosis, it may come in a varied form. So this is one of the manifestations of psychosis. If you take the detailed history of the parent, they may have any other psychotic history, you know, which is not reflecting in her. Because this kind of excess, you understand, with the virulence of psychosis, you need to have some degree of psychosis in the previous generation. Maybe not in this form, but in some other form it was there, possibly. Probably, yes. Like a strong psychotic family, and you understand it's transmitted to the next generation as well, right? So maybe in course of time, I will need to prescribe a meroinum or a thuya to take care of, you know, like the strong psychosis. You understand? Medurinum probably because it's like a hereditary psychosis. It's a psychosis which has been transmitted to the next generation, right? So sometimes if you are even not getting any form of psychosis in or any form of the miasm in the previous generation, if you ask about particular diseases they had, you may come up with a particular miasm as well sometimes. He is on Thuya and he's doing better on Thuya, right? He has a Thuya constitution as well. They've given him Thuya, so that has improved as well, right? I got natrum features, but I thought of medurinum, to be very honest, because such a strong psychosis, but natrum has helped to a certain extent, you know. Anger, yes, sun aggravation, you know, there were quite a few. If it was like a one-sided case, no symptoms of natrum, maybe I would have started with medurinum, you know, considering that strong psychosis, right? বাবা মার কোনো বড় রোগ ছিল? সেরকম কিছু না. I'm asking if the parents had any major disease. She says, I don't know. The parents don't have it. They didn't have it. That's what I was sharing, that maybe they don't have this form of psychosis, but maybe the parents had some other form of psychosis, you know, which she doesn't know about, to be very honest. We're boosting today. We again follow her up in 8 weeks' time.